The 38-year-old pregnant woman with headache and visual symptoms. Clinical case. The 38-year-old pregnant woman was admitted to the hospital at 33 weeks, 3 days of gestation because of headache and visual symptoms, neck and back pain, occipital headache, vomiting, and a self-report temperature of 38.9 centigrade temperature. The patient felt the onset of the panic attack followed by tunnel vision. She began to hyperventilate and her vision went black from the periphery near the center. The symptoms lasted for approximately 2 minutes and were followed by spots in her visuals, felt headache, neck pain that radiated to the arms, nausea and disease, normal fetal movement, and endocardial deposits.
Headache in pregnant women when to worry. Headaches during pregnancy are quite common, but it is not always easy to distinguish between a recurring, pre-existing migraine condition and a headache caused by a pregnancy complication. Physicians should pay close attention when a pregnant woman presents with a severe headache, especially if she has elevated blood pressure or lack of past headache history. She could be at risk for pregnancy complications, including preeclampsia, which put both the mother and fetus at risk. Those patients should be referred immediately for neuroimaging and monitoring for preeclampsia. The first clinical study, Acute Headache Diagnosis in Pregnant Women, a hospital-based study for making diagnostic decisions about headaches in pregnant women, comes from Montefiore Health System and Albert Einstein College of Medicine of Yeshiva University. This is the largest of its kind and is published in the journal Neurology on August 2015 by Matthew S. Robbins, MD, Director of Inpatient Services at Montefiore Headache Center and Chief of Neurology at Jack D. Weiler Hospital of Montefiore, and Associate Professor of Clinical Neurology at Einstein. Preeclampsia typically occurs during the second or third trimester of pregnancy and may be related to an abnormal interaction of blood vessels that supply the placenta. Symptoms and signs can include high blood pressure, headaches, blurry vision, or abdominal pain, although some patients may have no symptoms. Depending on the severity and the age of the fetus, treatment ranges from bed rest for mild preeclampsia to premature delivery if the condition is severe. Dr. Robbins and colleagues analyzed records of every pregnant woman with headache who had been referred for a neurological consultation at Weiler Hospital over a 5-year period. The researchers found 90% of the primary headache were migraines. Among the secondary headache, 51% were diagnosed with pregnancy-related high blood pressure, including the 38% of women who had preeclampsia. The most important indicator of a secondary headache among pregnant women is high blood pressure. Women with headache plus high blood pressure faced a 17-fold increased likelihood that their headaches were caused by some other condition. In most of these patients, their elevated blood pressure was driven by preeclampsia. The researchers found that another red flag for a headache that should be taken seriously was lack of a previous history of headache, which was associated with a 5-fold increased likelihood that the headache was secondary to something else. Other warning signs were fever,
Continuando. Diagnosis: embolic strokes to the lower endocarditis, which was most likely caused by admitting infection toxocariasis with secondary hypereosinophilia syndrome. Lower endocarditis is a form of progressive cardiomyopathy which affects the endocardium occurs with white blood cell proliferation, specifically of eosinophil. Restrictive cardiomyopathy is defined as disease of the heart muscle which result in impaired filling of the heart ventricles during diastole. And toxocariasis is an illness of human caused by larvae. And hypereosinophil syndrome is a disease characterized by a persistently elevated eosinophil count in the blood for at least 6 months without any reconceivable cause with involvement of either the heart, the system nervous, or bone marrow. Pros and cons. Cons: the patient was going regularly to examination for her pregnancies by the levels of eosinophils and other symptoms were ignored, causing infection to develop widely. Pros: the cons examination on the body kept him healthy and the treatment was entirely focused on the mother and the prevent the interruption of the gestation. Issues applied in Ecuador, the diagnostics and the treatment is a case demand weeks with just one the multiple examination used to last hours. In our country, the time the doctor usually has attended a patient lasts few minutes, so that would have prolonged the diagnosis and therefore would have complicated the illness and its treatment.